Did you know that black newborns are 3 times more likely to die than white newborns? But when those same black babies are cared for by black doctors, their mortality rate is cut by more than half.
Health. Dr. Hardiman, thanks so much for being with us this morning.
Thanks for having me.
Yeah, so you have for a long time researched maternal mortality and mortality of newborns. We know that black babies die at 3 times the rate of white babies, but your research gives us just a little bit of insight about why that might be.
Yeah, so, what we were really interested in studying with this particular analysis was the patient-physician relationship and if racial concordance, so having a provider, a physician that is the same racial identity as the newborn, if that mattered for health outcomes. So we leveraged some really important data across, almost 20 years to look at nearly 2 million births. And to understand what was going on here. And what we saw was that when a black infant, a black newborn had a black physician caring for them, the likelihood of infant death decreased significantly.
To understand why representation matters today, we have to look at where American medicine began. For centuries, the healthcare system wasn't just indifferent to black bodies, it was predatory. During slavery, black people were used as clinical material. J. Marion Sims, often called the father of modern gynecology, perfected his techniques by performing agonizing surgeries on enslaved women like Annika, Betsy, and Lucy without anesthesia because of the racist myth that black people didn't feel pain the same way.
People didn't know that he experimented on enslaved women. They didn't know that 2.5 years into his experimental trial, when his white medical assistants quit, he trained these enslaved women to serve as nurses. They were still his patients. They were still his slaves that he either owned or leased, and they still served as surgical assistants. So that part of the story was left out.